what cannabis is revealing is broader challenges within healthcare. Healthcare often struggles to manage behaviors. They often struggle to manage exposures, and they often struggle to manage patient decisions that are occurring outside of the traditional clinical environments. The blind spots have always been there. Cannabis is just saying, hey, shine a light on it. We can see it now because it's very evident. The industry has been growing. We have added the medical benefit acceptance through the rescheduling of medical cannabis. But we continue to have a documentation challenge, a policy challenge, and patient safety challenge because we cannot see this data. And when it comes to operations, it really means thinking about what that patient experience is as they navigate through your environment. What happens at intake? What do you typically do when they come in with their scheduled medications? Do you send it home with their family and you order from the pharmacy? With cannabis, you won't be able to order from a traditional pharmacy. So do you have relationships with the medical treatment centers in your area? Do you know the product formulary? Do you have visibility to any of the information that you're going to need to actually produce a working operational plan to actually execute on the gaps that you identify in your organization? And I think when you return to work, it's really important to start thinking, or when you go in as a patient, it's really important to start thinking, what is going to happen? What is going to happen? What can I say? When you get your HCAP survey, when they ask you about your medications, if they didn't talk to you about cannabis, we have now federal coverage and rights to demand that cannabis be seen as medicine, which is good for patients, but it really puts nursing leadership in a hot seat because we don't have a plan on what to do when cannabis enters the room. Next slide, please. So my simple call to action is, I want you to think. I want you to have an opinion, and I want you to understand that this is not a comfortable time in nursing leadership and operational leadership. So it's really important that we begin to ask the uncomfortable questions that will lead us to better clarity and better visibility of what's happening in our own systems. Ask, how are we identifying cannabis? Are we asking the traditional question? Do you take illegal drugs? Yes or no? That causes so much confusion because a patient's medicine is not illegal, and federally, it's not illegal. So when you only have that as an option to capture cannabis consumption, you're already way behind. So thinking about how we're documenting it. Are we only documenting cannabis use disorder? Are we only documenting cannabis hyperemesis syndrome? How do we document the therapeutic use of cannabis in healthcare environments when we don't have an ICD code for it? So it's not simply us being on the forefront, but really asking legislation, asking the systems that are meant to support us, asking the regulatory systems, the Department of Public Health, public safety, to really get engaged and build the nuggets and the bricks that we need to create this infrastructure. Because cannabis is the issue that we're discussing today, and that's what emerging today is, but supplement use is up. I always joke around that everybody's on ashwagandha. So there's other things that are happening that we're going to need to be able to see. And cannabis is our perfect moment because it allows us to see, allows us to educate, and it allows us to honor the plant the way it was meant to be honored as medicine in our healthcare environments. The reason we need to build the infrastructure is so that we don't lose the plant as we're trying to integrate it into our healthcare systems.